All right, well, welcome to Orange Therapy on YouTube. This is going to be a little bit different than my normal YouTube programming. This is actually a 2-hour presentation that I provided as a continuing education presentation for other counselors. But there's so much interest in ADHD and so much misinformation out there. I thought that I would record it this way so that you could have a listen as well. Sit back and let's learn about ADHD, treatment, diagnoses, kind of reframing it in our minds. Let's learn about all of those things right here together. Good morning. My name is Julie Mullins. I am a licensed professional counselor in South Carolina, and my private practice is called Orange Therapy. This particular presentation was first presented for continuing education credits for counselors through the Center for Counseling and Wellness, and I believe they have an option on their website, or they will have, for you to receive CEs if you are a professional counselor, to view that online. If not, maybe it will be presented again in the future. But at this time, I'm going to present effective strategies for treatment of ADHD across the lifespan. The reason I decided to record it separately from the continuing education is because there's a lot of information out there on the internet that isn't necessarily true or accurate or helpful, and so I wanted to provide this presentation. I know it's a long one, which is unusual for my YouTube channel, but I wanted to provide it for you to have a look at. So a little bit about me. I happen to be a Canadian kid. I was born a sensitive middle child with an older sister who is 4 and a bit years older than I am. And I was followed in birth order by a younger brother who is 16 months younger than I am. And my parents wanted a boy. We joke about that. Kelly was to be Mark. I was to be Mark. Then they had Mark and they called him Boy. I'm just going to leave that there. If you get bored with the presentation, you can start to analyze me if you would like. I have 2 kids. And when they were growing up, I did a course called Growing Kids God's Way. And it was a course designed to teach our children how to be good people, to be godly children. And one of the pieces that they had us teaching our children was how to be polite. And being polite is going to be different. Teaching your child to be polite is going to be different depending on the personality of your child. Now, bear with me for a second. Some of you, I can already feel you shaking your heads. Well, I had one child who was quite shy and one child who was gregarious and outgoing. It was going to be different for each of them to train them to be polite. My shy child needed to be taught to speak when spoken to answer questions. Now, beyond the general, hello, how are you doing? I didn't have expectations beyond that, but to say hello when somebody says hello to you, and then I would maybe speak up for her. But for my gregarious child, it meant, maybe calming them down, having them take a step back. You need to realize that the adults are talking now, right? So it's different for each of those children. Later on, as a professional counselor, as a LPCA, an associate, that licensed period when counselors are under supervision for 2 years, I was working with some clients. And when you first start out in counseling, you have the people who sometimes can't pay anything, and they don't have insurance. And often these people would come in, they were food insecure, so they were hungry. So I wanted to have something there available to them so that I could meet a need that they had so we could work together. Because, of course, we can't work together if your tummy's growling. You can't focus. Maslow's hierarchy of needs teaches us that. So I wanted to have a healthy snack, not something that was empty calories just to fill bellies. I wanted something healthy that was prepackaged, that wouldn't decay too quickly. So I picked up oranges and I had them in my drawer, and I would pretend maybe to be hungry so that I could offer somebody else an orange. for them to eat as well. And my supervisor laughed and he said, well, you were doing orange therapy. And I laughed and I was like, no, seriously, I really was doing orange therapy, right? Providing what the person needed. And that's really where my practice name, Orange Therapy, was born out of. Well, if you are a counselor today, or if you are a parent with an ADHD child, or a spouse, or you yourself are struggling with different facets and aspects of ADHD, I hope to provide you with enough information that you can identify patterns and processes and come in from a strength-based, hope-focused orientation to provide each of you with who are experiencing the negative pieces of ADHD to provide you with the orange that is right for you. First of all, this presentation, just to acknowledge that most of the resources come from a PESI certification course that I took, and it was called ADHD Clinical Services Provider, ADHD CCSP certification course, Strength-Based Interventions to Thrive with ADHD from Childhood to Adulthood, and it was an online course. It covered CBT strategies for kids and adolescents, supporting students with ADHD and anxiety, ADHD in children and adolescents, advances in diagnosis, treatment, and management, identifying and treating the 1 in 5 students with ADHD and learning disabilities who are returning to school misdiagnosed and misunderstood. This was a post-COVID course, and lots of that information is still applicable because we have students that have these dual diagnoses, these comorbid conditions that we need to understand the added complexity that ADHD can cause in these individuals. They presented ADHD, relationships, and sex, strategies to overcome the over and under functioner dynamic. If you are one of a couple and one of you struggles with many of the components of ADHD and the other doesn't, you are very familiar with that over functioner, under functioner dynamic due to the brain differences. There was another course, Adult ADHD, targeting executive skills to manage ADHD in adults. Extended adolescence, when 25 looks more like 18, changing the ADHD brain, moving beyond medication, and ADHD in children and adolescents, advances in diagnosis, treatment, and management. Other resources for this course are from various presentations by Gabor Mate and his book Scattered, also ADHD 2.0 by Hallowell and Rady, and lots of peer-reviewed journal articles, and also some clinical and personal experience. In our time together, if you watch through this presentation, you're going to discover what is ADHD, what causes it in the developmental cycle, what are different comorbidities. We're going to explore the fallout of ADHD in the individual and in society. We're going to kind of reframe our ideas about ADHD. And we're going to recognize that education is foremost in our treatment. We're going to educate. So there's so many factors and so much to cover. People think ADHD is trouble focusing and fidgeting, but if you look at this ADHD iceberg, you're going to recognize that there are so many more facets to it. Losing items relentlessly, chronic unemployment, trouble regulating emotions, auditory processing disorders, this all or nothing behavior, a poor sense of time. There's actually time blindness in the ADHD individual. Difficulty maintaining relationships. People struggle with depression and other comorbidities, anxieties because of the difficulties. Difficulty following and maintaining conversations. They're jumping all over the place. An inability to focus, even if there are no distractions, or a hyper-focusing on something. People sometimes will say, my child can't have ADHD. You should see how they focus on something. But that focus can't be directed like it can in the non-ADHD brain. So when you go into the room, you could be telling them that the house is burning down and they do not hear you, legitimately do not hear you because of the focus difficulties. So there's a lot to cover. The DSM tells us that ADHD is a neurodevelopmental disorder with a persistent pattern of inattention and or hyperactivity and impulsivity that interferes with functioning or development as characterized by inattention, hyperactivity, or a combination of both. Now, this inattention, impulsivity, or hyperactive behavior is developmentally inappropriate for the age. The symptoms last or have existed for at least 6 months. This isn't something that is a short-term something. This is something that has been ongoing that you've noticed. The symptoms are apparent in 2 or more settings: family, school, work. We're seeing this kind of across the spectrum. The onset of symptoms is prior to age 12. Now, this is usually, there is a traumatic brain injury that can be responsible for ADHD-like symptomology. Of course, that onset can be at any time when the brain injury occurs. But this is not due to another mental health disorder that we're seeing these particular symptoms. There are 3 types. It used to be ADD and ADHD. Now we have ADHD, but 3 specifiers: primarily inattentive type, primarily hyperactive type, or the combined type. For children and teens up to age 17, the criteria for having 6 specific symptoms, and for teens 17 and older, and for adults having 5 symptoms for at least 6 months that interfere with play, social life, school, and or work. So this is something that is ongoing, that's interfering with life. Now, we may have ADHD-like symptoms. We may struggle with different facets of ADHD, but in order to have diagnosed ADHD, you have to have 6 of these symptoms that I'm going to describe in a second. If you are a child under 17, older than 17, 5 of them need to be present. So several symptoms should have appeared before age 12 and be present in more than one situation, such as at home, at school, or work, and not be the result of a different mental health disorder. So potential inattentive symptoms: often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. Often has difficulty sustaining attention in tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. Often has difficulty organizing tasks and activities. Often avoids dislikes or is reluctant to engage in tasks that require sustained mental effort. Often loses things necessary for tasks or activities, is often easily distracted by extraneous stimuli, is often forgetful of daily activities. Potential hyperactivity symptoms: often fails to give close attention or makes careless mistakes in schoolwork, at work, or during activities, has difficulty sustaining tasks and play activities, often does not seem to listen to when spoken to directly, often does not follow through with instructions or fails to do things, often loses things necessary for tasks or activities, is often easily distracted by extraneous stimuli. Hyperactivity and impulsivity, the combined type symptoms: often fidgets with or taps hands or feet or squirms in seat, often leaves seat in situations when remaining seated is expected, often runs about or climbs in situations where it's inappropriate, often unable to play or take part in leisure activities quietly, is often on the go as if acting like driven by a motor, often talks excessively. And potential impulsivity symptoms: often blurts out an answer before a question has been completed, often has trouble waiting his or her turn, and often interrupts or intrudes on others. Now, if you see yourself in some of those things, that's understandable. In neurobiological terms, this is a neurobiological disorder. Many areas of the brain are impacted. Now, I am by no means a neurobiologist, but I want to present these pieces because it's important to know that the brain is impacted heavily with this particular diagnosis. The prefrontal cortex which is the brain region that's been implicated in executive functions like planning, decision making, working memory, personality expression, moderating social behavior, and controlling certain aspects of speech and language, is deeply affected. The basal ganglia, which is a group of subcortical nuclei responsible for motor control, as well as other roles, motor learning, executive functions, behaviors, and emotions, also heavily implicated. The cerebellum. This is really interesting because this part of the brain is responsible for balance. It's a large part of the brain, the largest part of the brain, and it initiates and coordinates movements, regulates temperature. Other areas enable speech, judgment, thinking and reasoning, problem solving, emotions, and learning. Other functions relate to hearing, touch, and other senses, so they're all affected. There's also evidence that there exists a deficit in connectivity of white matter tracts in key areas of the brain. This research is emerging. In the most general sense, the gray matter of the brain facilitates information processing, and the white matter facilitates information transfer. And both are critical for efficient operation of the neural networks responsible for a specific mental domain. Genetic pharmacological imaging and animal models highlight the important role of dopamine dysregulation in the neurobiology of attention deficit hyperactivity disorder. So there are all kinds of brain changes going on, and we're going to need to reach in and provide services that encompass and take into consideration all of these different areas of the brain. Now, if you are a clinician in private practice or in group practice, and you're sitting with a parent or an adult in front of you, you don't need to remember all of those pieces of the brain to tell them, because their eyes are going to glaze over anyways. They're going to, tune out when you start using these words. But you do need to understand that there are real brain differences in a person who is struggling with the impacts of ADHD. And so we need to recognize that this is a difference in the brain. This is not just somebody fidgeting in their seat. There are real brain differences at play. So in lay terms, we might call it a time management deficit, because there's now and there's not now for the ADHD brain. There's a consequences deficit, right? Because I'm going to jump first. That sounds like a good idea. I'm going to jump in and do that, but I don't think it through. Because remember all of those brain regions? My brain isn't going to think it through. That seems like a good idea at the time, right? That executive function isn't there. There's a maturity deficit. When we have a brain that is like this, the individual is 2 to 3 to 5 years younger in maturity than their age-related peers. There's a focus deficit, right? So if we're explaining this to parents, these are the lay terms that we can use. There's a focus deficit. Your child has difficulty directing their focus. The policeman in their brain is asleep. The one that decides where the focus needs to go has gone to sleep, and everything in the brain has gone willy-nilly. There's all kinds of traffic jams in there. There's a motivation and completion deficit. Right? It's difficult to get the motivation to do something that's due in a week if only now and not now exist. And there's that completion deficit, because that person is starting to do something and then, whoa, look over there. That looks like something fun to do. And they move on to something else. Or there's so many ideas coming in all the time that they start chasing the new idea before the old idea is finished. So it's not that they don't have great ideas, and it's not that they couldn't follow through, but they need to learn tools. They need to have the right orange to help them through to the completion. There's a planning deficit. Again, there's the now and there's the not now. So why would I plan? I'm going to fly by the seat of my pants. A conception deficit, a cooperation deficit. So there are lots of different areas where we can look at this in lay terms to be able to explain it to our children, to ourselves, to others, instead of ADHD being BAD, which is shame, right? And we look at this particular slide, we may laugh, right? We may look at this and go, ADHD makes me look like I don't understand basic cause and effect. I suck. What does it feel like to have ADHD? It feels like my brain is understeering. I'm 99% done with a project, but I abandon it and never finish it because I have a new idea which I know is even better until it's 99% done, and then, right? They're shaming labels, and often humor deflects the shame for the client, but the internal negative rumination can be painfully debilitating. Let's reconsider the labels. ADHD clients see themselves as bad, and shame leads to disconnect, and behaviors lead to isolation and disconnect and further shame. So they act out because they feel shameful in an effort to deflect the shame, but they only contribute further to it. So since I don't think we have any neuropsychologists or neurobiologists here, and although I find it fascinating, and our clients aren't neurobiologists, and their parents probably aren't either, we need to be able to explain what's going on in more understandable ways. In the book ADHD 2.0 by Hallowell and Rady, they refer to a trait, which we'll explore in a moment, but they give the illustration of an ADHD brain being like a Ferrari engine with bicycle brakes. It's a really strong brain, but the stopping capacity isn't there. It just is revving on 100 all the time, onto the next thing, onto the next thing, onto the next thing. Another really good illustration that I alluded to earlier is a police officer asleep in the brain. It's not necessarily a deficit then, it's a great brain like a Ferrari, but the police officer is asleep and not directing traffic, so you're being pulled everywhere all the time. The top meme in this made me laugh, and I added it in so that I could share a little bit of a story too. I had a picture that I had drawn for my father that was, I started when I was 13 and finished when I was 26. It was 13 years in the making. It was a drawing of a raccoon in a tree because I got most of the way done and got distracted on something else. Now, I don't have diagnosable ADHD, but there are traits that are present. And so I want to talk about that as well. Perspective matters. Where we stand, what viewpoint we see this disorder from, will determine whether we are shaming or accepting. And it's going to impact our treatment at the very core. And this is a reminder to me, one that I sit with from time to time, actually quite often. In graduate school, we were instructed to read a passage with some background details from one perspective. And they told us about the family background and what this person was like. And then we were instructed to read the passage again, but we were given different background details. And our perspective changed. Perspective matters. How we view ADHD matters. Is it BAD? Is it a disorder? Is it a trait? What we choose to believe, how we view this, will impact our selected oranges. Shame-based treatments are not beneficial. If you have any questions in this regard or question my assertion, I urge you to explore the work of Brené Brown. I could go on for hours on her work, but suffice it to say, our perspective on this diagnosis is of utmost importance, as is how we view every other disorder, diagnosis, or struggle on the person we have in front of us. So as a part of my own treatment plan, I check my perception of the person in front of me. Not what is wrong with them, but what are their traits? What are their strengths? What's causing them difficulties at this current time? What do we need to educate them more about? Developing self-acceptance, perhaps? What areas do we need to strengthen? I need to make sure that I include these things in my treatment plans. And the next step is to explore development. In order to have more information to create interventions, I need to know what pathways were challenged so I can go back, metaphorically speaking, and help the client in those areas. All right, so executive functioning is a higher level psychological process responsible for cueing, directing, and coordinating multiple aspects of perception, cognition, emotion, and behavior during purposeful, goal-directed problem-solving behavior. Executive functioning is a higher level psychological process responsible for cueing, directing, and coordinating multiple aspects of perception, cognition, emotion, and behavior during purposeful, goal directed problem solving behavior. Did you notice anything in those last two slides? So I left them in here on purpose to illustrate a point. Sometimes when the mind is working on a problem, a great idea is in front of us, and we think off in all of those directions, and we're like, this is great, and then we sit back down, we get distracted by something, and we look back again and we go, oh, that's fantastic, to prove a point, to get the point across here. And I built this particular presentation of ADHD just demonstrating what happens when the brain gets distracted. You lose your spot. It's very frustrating to go back to that. And executive functioning is responsible for this direction of our attention. And in the ADHD brain, that piece is not very well coordinated and controlled because, as we discovered earlier, the ADHD brain is in fact different. According to these authors, executive function is how efficiently you decide what to do. Decision paralysis is a real thing in this disorder. So if you struggle with that, you are not alone. There are two networks in the brain that are working kind of against each other in a push-pull, tug-tug kind of network. The brain has a working network where ideas and tasks are held and the individual can work on them. This task-positive network is active during attention-demanding tasks, and it includes our conscious attention toward the external environment. The default mode network is a network of interacting brain regions that's active when the person is not focused on the outside world. So it's the mind wandering, it's the monkey mind going everywhere. When we're awake, our brains are constantly processing information, and it happens both consciously and subconsciously. The default mode network activates when we're not focused on a specific task. In some cases, people with ADHD have trouble focusing their attention on tasks because their default mode network is overactive compared to people without ADHD. So they have incredibly creative minds that are bouncing all over the place, but difficult being reined in and directed. You know, the steering system or the braking system on that Ferrari brain doesn't work very well. The default mode network is a brain system responsible for your self-referential inner monologue or wandering mind. The default mode network is thought to recruit memories and associations in recent events to help you plan your future. So strong executive function is needed to stay in the task-positive network. And it can be developed to a degree, and that's what we're going to help our patients who are diagnosed ADHD do. I want us to consider a new name for this disorder, maybe executive function deficit disorder, maybe to reduce the stigma of ADHD being referred to as BAD. And there are 7 executive functions, and they're all impacted when somebody has diagnosed ADHD. The first executive function is self-awareness, and that's being aware of what you do as you're doing it. So having that self-monitoring, being able to be in different areas of the brain at the same time, paying attention to what you're doing. Inhibition, the ability to stop what you're doing if it's not working, right? You hear ADHD kids and adults saying, I couldn't stop myself. I just had to keep going, and it wasn't working, but they kept going. Nonverbal working memory, so a nonverbal recall of the past. Hindsight, to help manage the future. Foresight, to look back and help us look ahead and plan what to do next. It's the development of time management skills. And in an ADHD brain, this isn't functioning properly. The verbal working memory, The mind's voice is also impacted in this executive function region. And this is the mind's voice. It's the ability to talk to ourselves and guide ourselves through an activity. It's self-instruction kind of way. You know, when you see little kids playing with dolls, they have the dolls talking to one another, and I'm going to go over and do this, and I'm going to come with you, and then they take the dolls away. And as a child gets older, they kind of hum instructions to themselves while they're doing something. And then yet further on, they have it entirely inside their mind. Well, that's very difficult for somebody with executive function deficits to do. So they're constantly talking through things out loud as they do them. Emotional regulation, the ability to calm and manage one's own emotions, because the mind isn't integrated like a non-ADHD mind, so it is more difficult. There's difficulty with motivation regulation, the ability to motivate oneself in the absence of external reinforcers, whether those are rewards or consequences. The person, because they're in the moment and they're not seeing the consequences, they're not even being motivated by them. But executive function is responsible for this motivation, regulation, and self-directed motivation. Executive function is also responsible for planning and problem solving, the ability to think of options, anticipate obstacles, and identify solutions. All of these things are impacted in the person with ADHD. I laugh at the number 2, inhibition, the ability to stop what you're doing if it's not working. I have, since the time I was little, walked into rooms talking. I still do it. I'm 53 years old, and I'll walk into a room talking, and I'm like, dang it, did it again, because people are engaged in a conversation, and I just walk in talking about what I'm doing. I somehow seem to be incapable of stopping that. And if you're one of the people who watched the presentation live, you saw that I was, I would interrupt Ileana while she was talking sometimes. So it can be taught, because in my sessions, most of the time, I don't interrupt my clients and jump in with a thought. I'm able to use the tools by jotting down that question on a piece of paper so that I can hold it back and talk to the person later. And that's what we're going to teach our clients to be able to do. Or perhaps this is a trait. Brené Brown tells us that shame magnifies and amplifies negative expression and reduces the ability to view ourselves, seek help, and grow. So what if we saw ADHD instead as a trait? Maybe it's like fire. Fire isn't good or bad, but if we stick our hand in a fire, we can get burned. We can put a pot of water on the fire and cook our dinner. So fire's not good or bad. Maybe it's like fire. This vast trait, the variable attention stimulus trait, is what Hallowell and Rady have called it. They said maybe it's a bunch of paradoxical tendencies that exist. A lack of focus combined with the ability to super focus. A lack of direction combined with highly directed entrepreneurialism. A tendency to procrastinate combined with a knack of getting a week's worth of work done in 2 hours. Impulsive, wrong-headed decision-making combined with inventive, out-of-the-blue problem-solving. Interpersonal cluelessness combined with an uncanny intuition and empathy. Maybe it's all of these things together. That impulsive, wrong-headed decision-making combined with inventive, out-of-the-blue problem-solving, Hallowell and Rady talk about that as being like shooting yourself in the foot, but at the split moment, discovering a way to treat that gunshot wound with what's on hand. So is the trait problematic or useful? That depends. With a mind for education and helping the client identify their traits as parts of them, how can I use what they do for good mentally? This removes shame. The idea that they have lots and lots of ideas is useful. The difficulty of sticking to an idea needs to be trained. So it's not useful or problematic. It's like fire. It depends on how it's used. Hallowell and Rady have this list of of traits on page 17 and 18 in their book, and I'm actually going to grab it off my shelf. Because I want to read this to you. It's useful because the individual is passionate, zealous, idealistic. They'll sacrifice everything for a cause or a friend. But problematic in that it can become rigid in the service of a cause, can become fanatical, strident, or traditional, a Captain Ahab syndrome. Useful, meticulous at times, especially projects that matter a great deal. Problematic, usually disorganized, even chaotically so. Chaos can rule to such an extent that school, job, and marriage hang in the balance. Useful, can get a lot done in a short amount of time. Problematic, fundamentally different sense of time. There's now and not now in this world, so procrastination rules, and things rarely get done on time. Useful, dreamer par excellence, visionary, lives on the wings of imagination and flights of fancy. Problematic, sometimes so bored by reality that he or she ignores it and gets into trouble for having done so. Useful, honest to a fault, will say what others don't dare to say, outspoken, blunt. Problematic, can hurt feelings and damage self, can unwittingly be cruel, which is the last thing he or she wants to do. Useful, intense desire to be free and independent, own boss, master of fate. Problematic, trouble working on teams, trouble taking orders, trouble with intimacy in private life. Useful, naturally creative. Ideas pop up all the time like popcorn in a machine. Problematic, trouble organizing all the ideas and doing something productive with them. Useful, naturally curious, always wanting to know who, what, where, when, why, how, never satisfied until he or she gets the answer. Problematic, easily distracted by novelty or any puzzle, conundrum, unsolved problem, or beguiling opportunity, however irrelevant it may be. Useful, enormously energetic, seemingly indefeatable. Problematic, impulsive, can't sit still or linger over a conversation or ponder an idea with a colleague or a relative. Useful, mind like a steel trap, can remember details from years ago. Problematic, forgets what he or she went into the next room to get, forget where he or she put the car keys, forgets wallet, glasses, umbrellas, leaves groceries on the roof of the car, and drives off. Useful, full of ideas. Problematic, so many ideas, they choke on the growth of any single one. Useful, decisive, can make an important complex decision in a split second. Problematic, impatient, hate to wrestle with ambiguity, shoots from the hip. Useful, initial surge of excitement over a new plan, deal, idea, project, or relationship. Problematic, excitement peters out in the middle phase, trouble sustaining interest. Useful, takes responsibility, gets done what needs to get done. Problematic, trouble delegating, trusting that others can do it as well as he or she can. And it goes on. So is the trait useful or problematic? It depends. We need to give the individual sitting in front of us the practical, pragmatic tools to help them so that we can develop a treatment plan. This is a picture of some gnarled trees that are close to a coastline. And there are trees in Canada on the coast. They're gnarled like this. But inland a few miles, they are ramrod straight and many feet high. 30, 40 feet high. But they're gnarled and small on the coast. The difference was the environment in which they grew. Same genes with different circumstances lead to vastly different presentations in ADHD symptomology. Understanding this helps us treat them. We need to look at the development of the individual sitting in front of us, because this combination of factors, nature, nurture, and sensitivity, this matters in the development and the developmental course of ADHD and how high functioning the individual is going to be. Some people who present with traits, who present with traits who are in families where they have support, where they aren't surrounded by chaos, where they're not having to figure things out on their own, while they still may have disturbances of attention and focus and what people would call stick-to-itiveness, they do not have the same presentation as somebody who has these traits, who is raised in a chaotic home environment where they don't learn and use compensatory tools. So nature, this is the question, is it nature or is it nurture? Well, heritability of a disorder versus traits is what we're going to be talking about. Twin studies indicate that 75 to 90% of ADHD is caused by genetic factors. If one person in a family is diagnosed with ADHD, there's a 25 to 35% probability that another member also has ADHD, compared to 4 to 6% probability for someone in the general population. These are the traditional studies. Between 10% and 35% of children with ADHD have a first-degree relative with past or present diagnosable ADHD. And we can be non-diagnosable once we learn enough tools to be able to function. All right? Approximately 1/2 of parents who had ADHD will have a child with the disorder. There also may be non-genetic factors as well, including prenatal exposure to nicotine by mothers who smoked, anoxia in the neonatal period of infancy, lack of oxygen right after childbirth, childhood exposure to high quantities of lead. All of these things can lead to ADHD. Gabor Mate says, however, that to assume ADHD is heritable would be like believing that if there are 3 generations of butchers or bakers or candlestick makers in a family, then meat cutting, baking, and candle manufacturing must also be genetic. So he points out the fact that 3/4 of brain development occurs after the child is born. That means that wiring of our brain, growth of our brain, occurs with feedback from the environment. And he asserts that although ADHD is found in families, it doesn't mean that the disorder is entirely heritable. Like the trees growing on the coast versus inland further, the environment in which they develop makes a difference. So while they're correlated, he asserts, they're not necessarily heritable. Family atmosphere in which the child spends early formative years has a major impact on brain development. We pass along our ways of being, right? And you say, well, Julie, what about those twin studies? Well, even if we think of identical twin studies where they're adopted into different families, they still have the stress of being separated from one another, from their mother, who was stressed out during her pregnancy because she was trying to decide whether she was going to keep her children or have to give them up. That, and the wash of stress hormones that impact the developing child within the mother, all of these impact the developmental trajectory on the brain. And by the way, in those twin studies, there's only a 50 to 60% concordance of traits. Gabor argues that if this disorder is entirely heritable, rates would be expected to be closer to 100%. So nurture needs to be taken into consideration when investigating and working on treatment. This is actually really good news for us counselors, because if nurture plays a part and we change the environment, we work on the family system, we can help people change their brains. We know that brains can change through neuroplasticity, neurogenetics, that neuro regeneration of neurons. The brain, the neurons that fire together, wire together, so we can learn new ways of being. We can wire our brain a little bit differently. We also need to understand that 25 to 30% of cases of ADHD are acquired or caused by brain trauma. 15 to 25% prenatal and perinatal brain injuries, maternal smoking, drinking, premature birth. 3 to 7% postnatal brain injuries, head trauma, infections, tumors, lead poisoning, PANDAS. Most of the individuals with acquired ADHD, so from those traumas and injuries, are males. The male brain is more prone to injury and genetic difficulties than the female brain. We need to know all of those things. But we also need to know, what does the family system look like? And some of our interventions need to be focused on identification of ADHD and other difficulties within the family system and assisting with skills development at this level. One of the case studies I'll present later on will present this idea in context. There is some research that the electromagnetic fields around power lines, even cell phones and Wi-Fi, contribute to ADHD symptomology. Food has also been implicated. What do we know about these multi-generational chaotic home environments related to diet? Is it a Mediterranean diet? No. In these multi-generational chaotic home environments, they are eating high-fat, high-sugar processed foods filled with preservatives and food coloring, all of which have been implicated in this disorder. I hope you're starting to see that it is not any one thing. It's so many. We're going to talk about sensitivity playing a part in the very next slide. What Gabor Mate suggests is that sensitivity is what's being inherited, and being sensitive within a challenging or chaotic environment leads to dysfunctional development. He presents the sensitive person within the environment trying to make sense, to figure it out. So their brain naturally bounces around and neural connections are impacted as a result. How can I focus on any one thing if everything appears to be important to keep me safe? If I'm sensitive, I take in everything. The highly sensitive person trait is best explained with the acronym DOES. There's a depth of processing, overstimulation, emotional responsivity, empathy, and sensitivity to subtleties in the environment. And sensitivity and ADHD do seem to intersect. This needs to be addressed, again, from a position of a trait, a way of being in the world, one that can be supported by the client themselves, not as something to be vilified, shamed, or otherwise injured. This is the way the person is, so we need to work with them this way. At least 5% of the population in struggles with ADHD, and so in South Carolina that works out to however many people it works out to. You can look it up on the census.gov. I left this typo in again as an illustration of, moving too fast with this style of brain and thinking patterns to stay on any one thing. There are many comorbidities. Roughly 80% of those diagnosed with ADHD are diagnosed with at least one other psychiatric disorder at some point during their lifetime. The most common ADHD comorbidities are learning disabilities, anxiety, depression, sensory processing disorder, oppositional defiant disorder. And I neglected to put on this addiction as well, is something that we see a lot of as a comorbidity. So active addiction and somebody who is in treatment for addictions. The Academy of Pediatrics recommends every child with ADHD should be screened for other disorders and problems. We need to be watching for them. Examples of oppositional defiant disorder behaviors include often losing their temper, arguing with adults, refusing to comply with adults' rules or requests, often getting angry, being resentful, or wanting to hurt someone whom they feel has hurt them or caused problems for them, deliberately annoying others, easily becoming annoyed with others, often blaming other people for their own mistakes and behaviors. Examples of conduct disorder include breaking serious rules such as running away, staying out at night when told not to, or skipping school, being aggressive in a way that causes harm such as bullying, fighting, or being cruel to animals, lying or stealing, or damaging other people's property on purpose. Learning disabilities that we can see are dyslexia, difficulty with reading, dyscalculia, difficulty with math, and dysgraphia, difficulty in writing. When I was working as a veterinary technician, we would often write down telephone numbers. And if somebody was calling my patient that I'd been assigned to, that I did the intake on, they would know that in the last 4 digits, if they got a wrong number, that they needed to flip the middle two, because I constantly and still consistently do that. I have to follow with my finger and really move slowly when I'm writing down numbers, and often flip letters when I'm writing as well. And I know many of you do also, but we learn tools, we learn methods, we learn ways of functioning so that it doesn't impact us as severely. The combination of problems caused by ADHD and learning disabilities can make it particularly hard for a child to succeed at school. Properly diagnosing each disorder is important to getting the right kind of help for the child. Of course, there are more difficulties that have to be parsed out when that is the case. My dyslexia is very mild. I think that a lot of people have a mild dyslexia. And I had an educator for a father. Lots of reading to and by me was encouraged growing up. Again, strengthening the parts of the brain that need to be strengthened so that you can function appropriately. We need to do the same thing for these other patients, because it is not benign. If left untreated, the impulsivity, the lack of foresight, the comorbid addiction lead to shortened lifespans. On average, a person with ADHD has a lifespan shortened by 13 years from expectancy, and combined with the many comorbidities that could be present, up to 21 years can be lost. 21 years of creativity and silliness and what these individuals have to offer to the world. So we need to figure out a way. We need to figure out some treatments. And I know it was a long preamble, but it was necessary. If we're not aware of development and challenges, family dynamics, and social influences, we are woefully uninformed and unprepared. And I know we all have, in the CE presentation, we all completed education required to be able to treat, but it's good to remind us how to do so, the different things that we need to look at. The first line of treatment is to educate the client and the parent or guardian. The individual is not BAD. They are struggling with a real brain difference of ADHD. Explain to the parent the vast trait, or a Ferrari engine with bicycle brakes framework, or the police officer asleep at the job. Educate them of the many ways you're going to explore, encounter, and treat the trait. Educate the client's parents on the strengths and need to help the child grow in those areas. It's about shaping and coaching, helping development. Educate the clients about their trait and explore their self-talk. Reframe automatic negative thoughts with cognitive behavior therapy skills. Educate your clients and families. It's important to coach, help, train, and all of those things with loving acceptance for the person with ADHD difficulties. I love this quote. It says, "To feel understood is the one pain medicine that soothes the deepest wounds. Sitting eye to eye, heart to heart with someone who gets your pain is worth more than 1,000 hours of therapy." We need at least one person to understand that. If you've got a child who's struggling with ADHD, this is again from ADHD 2.0 by Rady and Halliwell. They talk about giving this questionnaire and taking it in to your child's teachers, because we want to have them seen as multifaceted, not just for this one diagnosis or one trait. We want them to have it pointed out to them. These are their strengths. These are the things that they want you to know. So here are some important questions. What are 3 or 4 things you're best at doing? What are 3 or 4 things you like doing the most? What 3 or 4 activities or achievements have brought you the most praise in your life? What are your 3 or 4 most cherished goals? What 3 or 4 things would you like most to get better at? What do others praise you for but you take for granted? What, if anything, is easy for you but hard for others? What do you spend a lot of time doing that you're really bad at? What could your teacher or supervisor do so that your time could be spent more productively? And if you weren't afraid of getting in trouble, what would you tell your teacher or supervisor that he or she doesn't understand about you? They're pretty powerful questions, aren't they? Clinicians trained in more traditional psychotherapy techniques may have a tendency to focus on the psychological baggage of ADHD, the depression, anxiety, and the low self-esteem, and never relate them to ADHD issues that generate the feelings. Instead, such feelings may be interpreted psychodynamically, while the real practical challenges proposed by ADHD go entirely unexplained. So we need to look at counseling different, educate the client about ADHD, about the difference in their brain, and set goals. Find out from your client where this is impacting them the most and help them develop self-management strategies. I have several things that I do for even presentations like this one. I use a sticky note format because for me, working on a computer doesn't work. Once the information goes off of the screen, I forget that I have it there, that object permanence piece, I guess. So I write down different points, the direction that I want to go on sticky notes so that I can organize them in front of me along with quotations and have my sources and my resources noted on those, and I can shuffle them around. When I come into a room with my keys, I have one place at home I put my keys and one place at work that I put my keys, and I don't put my keys down until I get to that place. So I teach my clients to do the same thing. Carry your school bag through to the area that you work on your schoolwork, and then put it back in your bag. That way you're not losing schoolwork. These are self-management strategies. We need to recognize that our brains are different. If we aren't mindful, if we don't stay present, then our keys may end up in the fridge and the schoolwork may end up on the back deck and get rained on. We need to monitor our clients' progress, medication concerns, and treatment approaches. We need to keep on top of these things. We need to teach our clients how ADHD can influence life decisions, that their pause to check system may not be as strong. So to teach them to defer all decisions until they've had a moment to reflect. So to get used to saying, can I get back to you on that? It's a really powerful little phrase that can help that ADHD person slow down so that they're not jumping in. Because if somebody says to them, hey, you want to go out for coffee? And they say, yeah, and they go out for coffee. Then they're out for coffee and they get a phone call from somebody else. I thought you were coming over to help me paint my walls. And they had completely forgotten, because that piece, that immediacy, that now and not now, the ADHD brain, that sounds like a good idea, I'm going to go, and the rest of my plans have been forgotten. I need to be able to step back, understand that I'm going to do that. So maybe a management skill to teach your ADHD patient or parent who is working with their own ADHD child or spouse, calendars. Put everything on the calendar, and if somebody asks you to do something, train yourself to look at your calendar first. If these behaviors are practiced repeatedly, they do become more automatic. Increase your self-knowledge, goodness of fit life decisions. I was once given a job where I was doing some computer input, and that was not a good fit for me. I could do it, I could force myself to it, but my goodness, I was exhausted at the end of the day. That's not a fit for the way my brain works. My work that I'm doing now, where I'm having to take in lots of information all the time, this is a good fit for me. Become an active, pragmatic therapist. Find out how they're doing, what kinds of things are they forgetting, how has their schedule been overloaded, are they aware of what they have even next week. Teaching a college age student how to put things on a calendar, to break big projects down into small projects so there are those little dopamine hits to keep them going, working toward that long-term goal. Because again, this is a dopamine seeking type of brain challenge, and so they're going to seek the things that have that higher dopamine reward. And if I am doing a project that's not due now, it's due later, and I've got this huge project and I'm not getting the dopamine hit from it, it's going to be very difficult to stay at it. So break it into smaller pieces, rewarding yourself even with a small piece of chocolate. I heard it was a podcast I was listening to recently, and they were talking about changing your desire for different things and even having a chocolate. They talked about having a good quality chocolate and holding the chocolate for a moment and thinking about how good that chocolate was going to be, and then savoring the chocolate, really being present with the chocolate, increased the enjoyment and the dopamine hit you get from the chocolate. So being pragmatic might be teaching your client to do that at the end of those small pieces. Provide specific training in time management, organizational skills, and communication skills, and anger management. We need to recognize that these are areas that our clients may struggle in, and we need to provide extra training in those areas. Social skills training through role playing, appropriate person-to-person distance using the hula hoop test, particularly for younger children, although it's less needed post-COVID because people have a better idea of how far apart to stay from one another, but the ADHD child is still going to struggle with that. Practice social reciprocity. They're talking now, you're listening. Now ask them questions about what they said. Now speak back to them. Teaching your clients the art of apology, how to show gratitude. These are things that aren't necessarily going to be first and foremost, because the ADHD brain, once something has happened, they're jumping to something else, and they may look like they are not grateful for what has been given to them. Right? They may look like that child who's like, well, I got that, now I'm off to something else, when really their brain is focused on the other thing. They completely forgot that they hadn't said thank you. So teaching them that, providing specific training on the impact of sleep, movement, diet, and connection. Sleep, if we don't have enough sleep, that sleeplessness can present as ADHD. So making sure that sleep is important. Movement, even 20 minutes of movement in the morning, can help with focus. Having that appropriate diet and having connection. Human connection support is necessary for any treatment to be effective. According to Hallowell, it's love and lack of shame. And these are the central components. Now, we as clinicians can't write demonstrated love to my patient, but we can write in our notes, provided unconditional positive regard, which is counselor speak for love. So shame reduction, increase of positive connections by counselor, and educating the client and the family to do the same. Teaching the family not to shame the client, but to instead say, your brakes failed. We need to strengthen your brakes. What could we do differently? Having time in, holding the child, talking to them about what went wrong, and coaching them through rather than shaming them and separating them, which causes more difficulty. The next thing, and I alluded to it earlier, is the need for sleep. Educate our clients on the need for sleep, both adults and children. Sleep is needed to allow for attention as well as memory consolidation. Sleep allows us to process and retain new memories and skills. When we're asleep, glial cells clean up the bits in the brain that need to be trimmed off and pruned. It's like, I'm a Canadian, it's like a Zamboni. That's the thing that goes and cleans off the ice, goes through the brain, but it only works when we are sleeping. So we need to sleep to have that memory consolidation and reorganization in our brains. 30 to 56% of those with ADHD do have sleep disorders, and the stimulant medications can exacerbate this fact. So talking to your clients about taking their stimulant medications earlier in the day, because there is a place in this diagnosis for stimulant medications, is often necessary. We need to teach our patients good sleep hygiene and sleep protocols. What does it look like to prepare myself for sleep? How do I get my brain ready for it? Having a wind down time, staying away from screens, having a consistent bedtime and early waking routine is important. Getting the sunlight into our eyes earlier in the day can actually reset our circadian rhythms to help us to sleep better at night. So getting up in the morning to get that early morning sunshine in our eyes is really important. Shutting off our screens at least an hour prior to bedtime. and having the bedroom set aside for nothing else other than sleeping or sex if you are a consenting adult is really important. Now, in some homes, this isn't possible because they are smaller. So we need to find out from our clients. Like if we're giving them a whole bunch of protocols and ideas and they can't make those things happen in their homes, they're leaving not only feeling like, well, I can't change my brain. I also don't have the tools to use that they're telling me to use. Like they don't understand. I'm sleeping in the family room while my dad is watching TV still. So talking to them to see if they maybe can get get a hold of some noise canceling headphones, or something like that. Ensuring that the home is cool and dark for sleep, that they have a good bed, and again, recognizing the client that you have in front of you. Sometimes that's not possible, so going with the best that we can do. Tell me about your sleeping conditions. Let's see how we can reduce the harm of the environment that we're in so that you can get the sleep that you need. Maybe most kids have cell phones with at least earbuds, and they can use a sound machine to block out the sounds if they're having to share the space with somebody else. Wearing a sleep mask. I actually use the face masks over my eyes because you can bend the nose over your nose still with it upside down, and it attaches over your ears. Nothing goes behind your head, so it fits really nicely, and stays put and doesn't let light through. But with the sound machines, there are all kinds of different noise in the sound machines. You can have white noise or pink noise or other colors of noise. I happen to prefer and find that brown noise works best for quieting my brain. Interestingly enough, it has been discovered that for the ADHD brain, brown noise is one of the best noises for helping to quiet that mind to enable sleep to come. So have a look at that. Have your clients explore those different things, but the quality of sleep and the quantity of sleep cannot be ignored. We have to address this in our sessions as pragmatic counselors. Mindfulness-based meditation is another really important piece to add to our treatment. We need to strengthen the break. Now, remember, mindfulness-based meditation is not about making the mind completely quiet. Nobody can do that. Read Jay Shetty's book, what is it? Something of a Monk, Life of a Monk, or I'll remember it in a little bit. But Jay Shetty writes a book about being a monk, and he talks about meditation and the fact that even monks don't have empty minds. So meditation isn't about quieting the mind. And in this area, it's not about quieting the mind. If it ever really isn't, emptying the mind, rather, if it ever really isn't anything, but it's rather directing the mind. So strengthening the break, strengthening the police officer. So we sit quietly, we start to breathe, and we focus on the breath. And maybe we notice a thought. And of course we notice a thought because thoughts are going to pop up. And we just label that. There's a thought. And then we focus back on the breath. And when the mind wanders away again, without judgment, without being harsh, without calling ourselves names, oh, you idiot, you can't even focus for 2 minutes on your breath, none of that, we pull the attention back to the breath. We just notice it without judgment. We go back to the breath. Again, that's strengthening that direction keeper, that focus monitor, strengthening our brakes. Or rather, our attention switch. I can have some control over my attention by noticing what I'm paying attention to and directing attention to where I want to be. So if a client is in a classroom and they notice that they have spent the last 5 minutes looking out the window instead of paying attention to the teacher, rather than beating themselves up and saying, oh man, I did that again, just taking their attention and placing it where it needs to be. Because I can do that. I can notice when I'm not paying attention, and I can choose to pay attention. And I might have to do that 43 million times a day, but I can make that choice. And every time I make that choice, I'm strengthening those pathways because the neurons that fire together wire together. And I had a supervisor who was very fond of saying, it's medication or meditation. And we can choose to focus on that. And people with the vast trait, maybe meditation is enough. Both people who need medication and people who don't will benefit from meditation. That's an important part. It's an important strengthening of the brain. But those with most or all of the ADHD symptoms need medication. And we'll discuss in a later slide how medication is in fact helpful and how these things work together for a person with more severe presentation of symptomology. But everyone can benefit from meditation. It can be like the leg day piece of the workout of the brain for the week. And talking about workouts, exercise. Exercise is beneficial. If they have a choice between cramming 20 minutes in an exam or exercising for 20 minutes, they should choose exercise, is what LeCount et al. Said in their report. They said that after 20 minutes of exercise in ADD children, this was a report that was written a little while back, children had a greater response accuracy, better regulation. They stayed seated longer. They had longer reading duration. They had better reading and math skills and better inhibitory control. And we know that exercise increases dopamine post-event. We know that dopamine is indicated in ADHD symptomology. We need to bathe the brain in this happy tool. We also release brain-derived neurotropic factor, which helps with the rewiring of the brain. This is the miracle grow of the brain, and we have this when we exercise. It's increased in quantity in the brain. And there's a bonus when we're exercising, and if we're doing it outside in particular. What's also happening when we exercise is back and forth eye movement. The default mode network is activated and allowed to do its thing. It can wander. We can focus on the task positive network post-exercise. So there are lots of things that are happening. This back and forth eye movement helps us to process through all areas of the brain. If we exercise with friends, we also have the connection that we crave. Creative teachers and parents engage difficult tasks with activity. If you know, teachers, that you've got 5 kids in your class with ADHD and you're going to be teaching a difficult subject, get everybody off their tuchuses and jump around for 5 minutes before you teach it. It's going to benefit all of the brains, but particularly helpful for you and for the students with the ADHD brains to sit and focus, and it will make it easier for you to teach. If you're a parent and you know that your child is coming home from school and they have a ton of homework that they need to do, take them out for a walk first and then take them back in to focus on their homework. So you're not working against their brain. Work with their brain and with all of these pieces that we know are going to be beneficial. An interesting thing that has come up, remember the cerebellum that's responsible for balance? It's the largest part of your brain. It initiates and coordinates movement and regulates temperature and speech and regulates emotions and is involved in problem solving and learning and other functions. Well, studies show that balance work reduces hyperactivity, impulsivity, mood swings, and severity of ADHD symptoms. Whoa! Yoga has been implicated in strengthening the cerebellum, reducing anxiety and decreasing depression by increasing an abundance of GABA. And GABA is good for our brain, makes us feel good. And yoga is a great form of balancing work. There are other forms of balancing work you can use. Balance boards. I actually have one in my office and I have one at home. Paddle boarding. Loads of fun, great for balance. For those adults with ADHD, go and take a friend and go get some exercise paddleboarding. I was once walking through the woods with my daughter and granddaughter. We were going on a hike and there were some kids out there and they were playing on a slack line, and this is basically a tether strap. It's about 4 or 5 inches wide, maybe 6 inches wide, tethered between 2 trees. You could tether it between 2 poles and you get up on it and you walk across. It kind of bounces. Great for balance work. I now have one. It's so much fun. Skateboarding, extra credit for any exercise that is balance involved and being outdoors, because green therapy is also beneficial for all of us. Martial arts have been found to reduce the symptoms of ADHD and improve executive functioning in children and adults. And there are many forms of martial arts, like Aikido, and I'm going to say these all wrong, I'm sure. Capoeira, Ishii, Judo, Jiu-Jitsu, Kendo, Kung Fu, and Taekwondo. I know I said a bunch of those wrong, but you get the point, and hopefully you can forgive my mispronunciation. But they teach the children self-regulation skills and adults and social skills. It's a structured and disciplined practice. So they're learning these regulation pieces. There's an emphasis on using this for defense. So there is that, again, that self-regulation. I'm not going to use this against somebody. They earn belts. It's positive reinforcement, floods with dopamine, provides natural transitions from one move to another. And the information is broken down into small, manageable pieces. So they learn one step and then they learn the next step. And there's an emphasis on positive student-instructor relationships. So there's that connection piece that we need. Consistency and stability, because we're doing it this way all the time. There are other martial arts, Qigong or Tai Chi, which are a series of fluid, slow movements in the same sequence. That are usually taught all at once. They're not broken down, so they're a little bit different. So use these others. These things have been found to reduce cortisol in the body. And I love free resources. So for both yoga and martial arts, YouTube is great resources for financially and time-strapped individuals. I can't get to a lesson or I can't afford a lesson. So there are lots of great resources on YouTube. Search around. Now, using your own resource or using their own resource, if you're talking to a client or a parent on their own time, does require self-discipline or parental discipline to ensure compliance. So be checking in with them often. If they have committed to doing this, check in with them to see that they are doing it. All right. So we also need to provide for our clients tools and systems and practices to externalize executive function. And there are lots of different ways that we can go about that. And the guiding principles are to make these new behaviors automatic. Practice them, make this routine. Review strengths and growth areas frequency so that self-awareness develops. We need to teach people how to organize and plan, making master schedules, keeping all of your notes in one place. This is my study area, so all of my study things, my notes go here, so I know where to find them. I don't set anything down until I'm to its area. Clutter control needs to be taught. I don't know if you've ever been around ADHD individuals. They typically work within a mess. Everything that they own is out around them. But it's not a friend of the person with ADHD or VAS traits. And frankly, it's not the friend of anyone. There are lots of reasons for this, but I digressed. That was my default mode network at play. Get some clear bins. Understand that this might be the way I am. This might be the way my child is. They need to take out all of their toys to play with them, but to put them back in clear bins so that they can see what they have is beneficial. Financial organization. Again, the executive function makes it difficult to organize bills. Bills are forgotten. Talk to your clients if they're adults about forgotten bills. Often they're embarrassed by this, but remind them that this is a part of the way their brain is, but there are lots of tools and ways that we can manage this area. Let's look at making as many automatic payments as possible. And maybe you intend to save, but you keep forgetting to save. Well, you can set up with the bank an automatic savings withdrawal to move into your savings. And maybe have your client take notes during the session as you explore these different things, as you provide different tools. Have them write them down so they have something written so that when they leave, they have something to remember it by. Because, they're here, they're tracking with you, they've got it, but when they're there 100% of the time, right? They don't remember necessarily what it was that has been discussed. To teach time management, use timers for children, both for how long it's done and timing themselves as to how long it takes for them to do a task. Both of these things are beneficial. If you tell your child, we're going to have dinner in 30 minutes, what they hear is, we're not having dinner now. And they're involved in maybe playing a video game or playing with friends. And then you come to them and say, it's time for dinner. And they're like, oh, but I'm in the middle of this. And you're like, but I gave you that warning. If you set up a timer, they can see the countdown. It's getting closer. And then, when it's at the 5-minute mark, you need to wind down on your task to come in. There's that time blindness piece again. But if you can time tasks so that they develop a sense for, this is how long this task takes, it can help them. I use this for myself and have used it repeatedly for myself with timing how long it takes to actually do the dishes and put things into the dishwasher and take them out and do the laundry and different things, so that I know how long that task takes. I'm not going to try to do a task that takes a long period of time when I have to be somewhere else. It helps. It also helps with those secondary comorbid diagnoses. Maybe somebody has some depression and they don't feel like they have the energy to empty the dishwasher, but if they know that it only takes 2.5 minutes to empty a dishwasher, they might be more inclined to do it. Process and procedures for people doing things the same way every time. Have a place that's for keys. Have a place that's for books. Have a place that's for shoes. And then put them in those places so that when it's time for you to leave, you know where those things are. Remember also, in a home with an ADHD child, there's likely an ADHD parent who has the same difficulties. And what do we know about difficulties in ourselves? We're harder on those around us who have the same tendencies unless we've taken the time to heal ourselves. So talking to parents about these tools that they're going to use with their children, you may ask them, do you ever lose your keys? Do you ever misplace your keys? Well, this is going to be great for you, and you can model this behavior for them, and they're getting a twofer. Everybody loves that. Teaching healthy, adaptive thinking and living. This is how I am. This is a part of my traits, so I need to care for myself in these parameters. Some people don't need to do leg day, but some people need to do leg day rather. I need to do executive function day. I think of healthy adaptive thinking and living as being kind of like when I was on a cruise with my sister. Other people didn't need to wear a life jacket, but other people weren't panicking when they were out in the water like I was, and I needed a life jacket. Then I was able to enjoy my time out in the water snorkeling like everybody else. We need to have different oranges. We need to care for ourselves in different ways when there is an ADHD brain. We need to teach metacognition. We need to teach the person to pay attention. What am I thinking about? And check in often. Work on their self-talk. How can I accomplish what I need to do? And talk through the steps. Like I said earlier, that child playing, they're talking about what they're doing. As they're getting older, they may hum while they're doing it, and later it will be entirely internalized. And we need to do the same thing initially. They may have to talk it through. They may have to be walking in their house. I'm going to put my keys on the key rack when I get inside. I'm putting my keys on the key rack. Now I'm taking my book bag to the book bag spot. Talking it through. I need to have a place for everything and everything in its place. CogMed is a working memory training software program, and it's used as a complementary therapy for ADHD, and it's available online. It helps with working memory to help individuals remember instructions and solve problems, control impulses, and focus attention, and it's great. There are metacognitive strategies for identifying one's own learning style and needs and planning for a task, gathering and organizing materials, arranging a study space and schedule, monitoring mistakes. And we need to do all of these things. Even associating things with a familiar place helps people as they're moving forward with ADHD in their lives. So there was a study that psychosocial treatment alone was very poor compared to medication effects, and psychosocial treatment with methylphenidate was no better than methylphenidate alone. So, medication was found to reduce negative social interactions by both treated children and by their peers toward the child with ADHD. We use stimulant medication for the treatment of ADHD. Now, why stimulant medication? We need to be able to explain this to parents. So we're waking up the police officer. We're activating the frontal lobe and increasing its activity to drive attention and control. Stimulants increase attention. They decrease hyperactivity. They decrease impulsivity because, again, the executive function, that police officer is now awake. I'm able to direct attention. It does this by increasing dopamine as well, and they've been available for a very long time. They've been in use since 1933. There are two classes of stimulants. Those are amphetamines and methylphenidate. There are arguments against use, saying that it increased substance abuse, but findings are absolutely the opposite. What they find is when children and teens are treated with stimulant medication and they learn how to focus alongside of tools, that they are less likely to look for and less likely to impulsively engage in substance use and abuse. There was a longitudinal study of 140 children, 6 to 17 years old, assessed at baseline and then 10 years later, and they found that people who took ADHD stimulant medication did not have a statistically significant increase in alcohol, drug, or nicotine use disorders. And so it may be preventative, as other studies demonstrate, since it does provide the support needed to connect. Remember, if a child is acting out in impulsive ways, if they're not able to stay focused, if they're constantly getting in trouble, they've got these shame stores going on, they're going to be disconnected from their peers because their peers don't want to be around that type of behavior either. So then they're not seeking numbing or impulsively engaging in risky behaviors. Stimulant medication may actually prevent recovering addicts with ADHD from relapsing. And of course, this has to be done under careful supervision and after a period of demonstrated clean. Another multimodal treatment study demonstrated the efficacy of this, and it demonstrated that there was the largest effect size in a 50% decline of symptoms with medication, which is just phenomenal. And for our purpose, we need to be aware that medication is helpful and often necessary. We need to educate our clients that sometimes this is the case, even in those clients that don't want to be doing it. We also need to help parents and adults alike understand that because maturity level is lower than that of their peers, that accommodations might be needed. So for children with ADHD, we need to advocate for them to have breaks, to have longer testing times, and ability to move in their seats. Active seating, have balls that they sit on, and have time in. Don't separate them from others. For college students, we want to advocate and instruct them to seek out smaller class size, take fewer classes off the bat, and handpick faculty that is more engaging with the students, that provide more materials and handouts. Maybe help them to study with older students who took the course, look for a tutor. Normalize a longer duration to complete a degree. Normalize 5 years instead of 4 years. Normalize formal tutoring for these individuals. It's not that they can't learn, but they require different oranges. Have them take a time management seminar. Go to individual psychotherapy. Have an ADHD coach or career counseling. House them in substance-free dorms. And ask faculty to post assignments weekly on a website so that ADHD child can follow along where they are. For adults and employers to remember, and spouses of people with ADHD, remember this is a neurological disorder. And sometimes individuals will need both written and verbal instruction. They might need external time reminders for time blindness. And they might need long-term projects to be broken into many short-term projects. They may need more check-ins. If you're married to somebody with ADHD, you might need to check in more frequently with them. And it might be tiring. Maybe you can set up alerts on their phone. Working in teams can help. Setting up a self-reinforcement system. If I remember to do the things I need to do today, then I get this reward at the end of the day. Or I get this reward after each thing I remember to do. Looking for goodness of fit. ADHD brains do poorly with boring and repetitive work, so we need variety. Maybe hire a coach or an organizer or a therapist to help to organize things. Some studies suggest that alertness for this population is more evident in the mid-afternoon or evening, so maybe looking for jobs with these hours. Maybe a second shift is a better fit for these individuals. Sound suppression or noise canceling machines are very important, and breaks with movement. Again, movement is important. And not to be understated is the need for medication for people with diagnosed ADHD. Now, Dr. Hallowell, in his overseas case, he had a child who was 8 years old, male Chinese client named Samuel. He was treated through email, which is interesting because we're taught in graduate school that the most important piece of the therapeutic work is the connection between therapist and client. That's where most of the work takes place, but he never met this client. The instruction was through email to his mother overseas in Shanghai. After a presentation that Dr. Hallowell was making overseas, the mother came up to speak to him and said, "I need help for my son." Through email, everything was accomplished, even the assessment. The mother was sent the DSM criteria, and she checked all of the symptoms. He was able to establish trust with the mother. He had her read Driven to Distraction, which provided education for mom, and she passed that along to her husband and the school. I encourage you to read that. He educated them using a strength-based model of a car with bicycle brakes. And they were constantly talking to him about how strengthening his brakes can help him win races and not fly off the course, and that he could become a champion, that he has a strong brain, but he has bicycle brakes, and they needed to strengthen his brain. Mom was instructed to give him lots of hugs. Human connection and warmth was prescribed by Dr. Hallowell. Touch from parents was very important, and he had them remove corporal punishment, both at home and at school, which was phenomenal. The school jumped right on board. There was a promotion of a positive mindset. You can do this. You can work these breaks. There was no shaming. They read aloud to him each night, and each day before school, they reinforced loving statements and reviewed the fact that he can do it, that he has the tools. They spoke over him the truth that became his new internal dialogue. Where he had formerly had such a shaming dialogue, he now had this positive internal dialogue. He had Samuel do balancing exercises for cerebellar stimulation. He had him stand on one leg for 1 minute or until he falls over. Stand on one leg with eyes closed for 1 minute. Until he falls over. Take off his socks and put them back on without sitting down. Stand on a wobble board for as long as he can, up to 5 minutes. Then do it with eyes closed. Put 5 playing cards on the floor. Stand on one leg, bend over, and pick up one card at a time. Do a low plank hold for up to 3 minutes. Learn to juggle balls and then spend 3 to 5 minutes juggling. He improved within a matter of weeks, noticeably so, interpersonally and academically. It was interesting. He was given a piece of chocolate for being a top student after several weeks. He took it home. His mother asked if he wanted to eat it. His response? No, it's much too important to eat. I saw a family once, 3 female children, ages 11, 13, and 15. I also ended up seeing the biological father and mother. The 11-year-old was diagnosed with ADHD panic disorder, high suicidal ideation, and self-harm behavior. the 13-year-old ADHD, anxiety and panic attacks, and the 15-year-old vast traits, generalized anxiety disorder, major depressive disorder. The father demonstrated ADHD traits, generalized anxiety, mother generalized anxiety, and major depression. Through providing education to the family, starting with the middle child and then working out, there was education that was provided about a consistent sleep schedule, no shaming language, lots of connectedness. I didn't know about the balancing piece at that time, so I didn't engage them in the balancing piece, but we developed lots of tools for the family to use to make the home less chaotic. But just coming from a place of understanding for themselves and for one another, and increasing the love and the positive climate within the home, change began to happen. So I want to ask you, what oranges are you going to put in your drawer? What are you going to take from this presentation today? I hope that you've learned a lot. I hope that you contact me, reach out. I'd love to hear from you. And in just a moment, I'm going to close off with a really powerful poem. Right now, thank you for listening. ADHD. Take my hand and come with me. I want to teach you about ADHD. I need you to know I want to explain I have a very different brain. Sights, sounds, and thoughts collide. What to do first, I can't decide. Please understand I'm not to blame. I just can't process things the same. Take my hand and walk with me. Let me show you about ADHD. I try to behave, I want to be good, but sometimes forget to do as I should. Walk with me and wear my shoes. You'll see it's not the way I choose. I do not know what I'm supposed to do. My brain is slow getting the message through. Take my hand and talk with me. I want to tell you about ADHD. I rarely think before I talk. I often run when I should walk. It's hard to get my schoolwork done. My thoughts are outside having fun. I never know just where to start. I think with my feelings and see with my heart. Take my hand and stand by me. I want you to know about ADHD. It's hard to explain, but thought you should know. I can't help letting my feelings show. Sometimes I'm angry, jealous, or sad. I can feel overwhelmed, frustrated, and mad. I can't concentrate and I lose all my stuff. I try really hard, but it's never enough. Take my hand and learn with me. We need to know more about ADHD. I worry a lot about getting things wrong. Everything I do takes twice as long. Every day is exhausting for me, looking through the fog of ADHD. I'm often so misunderstood. I would change in a heartbeat if I could. Take my hand and listen to me. I want to share a secret about ADHD. I want you to know there is more to me. I'm not defined by it, you see. I'm sensitive, kind, and lots of fun. I'm blamed for things I haven't done. I'm the loyalest friend you'll ever know. I just need a chance to let it show. Take my hand and look at me. Just forget about the ADHD. I have real feelings just like you. The love in my heart is just as true. I may have a brain that can never rest, but please understand, I'm trying my best. I want you to know I need you to see I'm more than the label. I'm still me. The author for that is unknown. I really do hope that you learned something today. Whether you have ADHD or you don't, or a family member does or they doesn't, or they doesn't, or they don't, I want you to know that you are welcome here at Orange Therapy on YouTube, just exactly as you are.